secrets of our backyards to the realities of the third world. We take a raw and real look into the challenges and the pursuits of social justice. Welcome to The Point. I'm Callie, and I will be your guide as we explore through the intimate and sometimes humorous conversations with some of the world's most influential people who are combating some of the world's toughest problems. We offer a straight talk approach to examining education, healthcare, and entrepreneurship. We will learn what works and what can be avoided, because together we can and we will change the world. Great show for you today. We are talking to Baradina from CMB Hospital in La Pointe, Haiti. But before we do that, allow me to quickly bring some context to the healthcare in the developing world and specifically to Haiti. As you may or may not know, Haiti is an island in the Caribbean. It's west of the Dominican Republic and just south of the island of Cuba. It's about the size of Maryland, and it's home to an estimated 11 million people, out of which 3.5 million live in the capital city of Port-au-Prince. This leaves the 7 to 8 million remaining people spread out throughout the countryside of Haiti. So most people end up coming into Port-au-Prince to find jobs or attend school, but also Port-au-Prince is kind of the hub for access to what little healthcare is available. You see, there's not a lot of government hospitals, and there's essentially no real health insurance for employees, for the few that are employed through formal health care. And so that really makes the access to formal health care next to impossible for really over half of the country. In fact, it's estimated that only 8% of people living in rural Haiti have access to healthcare, making residents susceptible to otherwise preventable and treatable diseases. It's also important to note that health concerns and even life-threatening conditions are honestly often pushed to the side in an effort to feed the family or send their kids to school. And when it comes to maternal health, Haiti remains the highest maternal mortality rate in the Western Hemisphere, with an estimated 521 deaths for every 100,000 live births. In addition to this sobering statistic, approximately 1 in every 80 women in Haiti die from childbirth and pregnancy-related causes. Unfortunately, I myself have been witness to this, losing numerous friends over my 8-year stay in Haiti. But despite these statistics, I think it's important to note that there are human beings behind these numbers. It can be easy to think of people as black and white, rich and poor, privileged or oppressed, but it takes a special place inside of each of us to kind of push past those areas of complacency and really practice true empathy. I think the reality is a lot of us don't want to think that there's millions of people dying every year around the world from preventable and treatable diseases. These statistics can feel overwhelming, and we can a lot of times just be paralyzed because we don't even know where to start. But that's what we're hoping to do today. We're hoping to open up the conversation, learn from local people, and figure out what can we do that we're doing well and what can we stop doing that we're not doing so well. So at the Point Foundation, we believe that everybody has a right to access to healthcare regardless of their economic status. We also believe that the best way to save lives is through localized practices, which takes into consideration the realities and experiences of the population being served and pairs it with innovative, community-based solutions that offer both long-term and life-changing resolutions. And because we believe you don't have to reinvent the wheel to accomplish your goals, we've teamed up with like-minded organizations, allowing for us to extend our reach into the population being served. And that's where CMB comes in. CMB was founded in the 1940s and now serves a population of over 700,000 people. Facilities like CMB are vital when only 8% of the rural population has access to quality healthcare facilities. With a life expectancy of only 63 years old and less than half of Haitian children getting basic immunizations, places like CMB are literally life saving. So, without further ado, today we are talking to a world changing leader in the fight for equal access to healthcare. And here is Baradina. Welcome to the show, Baradina. So happy you took the time to spend with us today. Why don't you go ahead and tell us a little bit about yourself?
Thank you for having me, Callie. My name is Baradina. I was born and raised here in La Pointe. My family has lived here all our lives, and I've pretty much always been involved in CMB's work. I would volunteer at House of Hope over summer vacations, and then recently I officially joined the staff over a year ago to work as their public relations coordinator. And yeah, and I've hosted groups for them before that.
That's awesome. And can you tell us what CMB stands for?
Centre Médical Baraka Medical Center.
All right, so can you tell us a little bit about the history of CMB, like how it started? I know it has a rich history that dates back quite a few years. I'd love to hear about how and why it started.
Centre Médical Baraka, we're a not-for-profit hospital here in La Pointe, and we're founded in 1940s by two American missionary nurses. They started an acute care clinic. They were providing free medical care for people with wounds from spinal tuberculosis, and then they would later help with patients with paralysis. And that's how we started. And then we moved from that Arbor Clinic, we moved to a mud house, and then we had actual words, and then built an actual building that's still standing today.
Wow, that's incredible. Was the first building like just a general clinic, or did it specialize in something?
No, it was a general clinic, but it wasn't until 1948 that we had our first physician, and he was a Haitian general practitioner.
Because I know you're in northern Haiti in a very rural part. Was it difficult to kind of integrate into the community, being a lot of westernized healthcare, or was it welcomed by the community and they saw the need for it?
It was very welcome because we were the main hospital in a 30-mile radius. Besides the town hospital downtown, there wasn't any other hospital. So we were, even back then, we were the main referral hospital, and it was very welcome because there were a lot of needs in the community, and the people back then and so today were meeting these needs and providing all kinds of medical care.
But do you know what people did prior to, was it just that they practiced old traditions that they had for healthcare, or what did people do prior to CMB being there?
They either resorted to traditional medicine or would travel to great distances to go to the main town hospital.
So it sounds like you started with like a general clinic, but then I know it's expanded. Can you talk a little bit about all of the services that are offered?
Right now, we provide services in internal medicine, surgery, pediatrics, and obstetrics, and public health.
Can you speak more to the public health program?
In 2003, in partnership with an agency, we were able to start to launch a public health program doing preventive care, stuff like education and immunization, via our community health workers that actually are on the field, giving vitamin supplements and vaccines and educating the people.
I think a lot of healthcare organizations, especially in Haiti, are working towards more community health workers. Can you like help us understand exactly what that looks like? Is it like people that are leaders in the community come in for training at the hospital and then get trained and go out into the community?
Yes, community leaders are picked and trained and then sent out to reach those that are not able to come to the hospital. So pregnant ladies can get their prenatal vitamins right at home, and their kids can get their vaccines right at home. And HIV testing can be done on the field instead of having people travel miles and miles coming to the hospital. And we've seen an increase in immunization coverage. It has gone up from 30% to 100%.
Wow.
So due to the work of our community health workers.
Would you say that most women in the community, do they have their children at home, or are they able to come to CMB?
Right now, we're seeing an increase in deliveries. So I would say more and more are coming to the hospital to not only to have the babies, but even before for prenatal care and postnatal care.
I saw that you had was it the first set of triplets that were delivered?
We had another set. We actually had two other sets. One in 1980s, and then one in 2000. I can't remember the exact year, but our most recent one, yes, our most recent one was in July.
And they were, can you tell us a little bit about their story?
They were two boys and one girl, and their mom comes from a family of multiple births. So she had been expecting twins, not triplets. And then when she came to the hospital, it was confirmed that she would be having triplets, and it was her second pregnancy. And now she's gone from one child to four children, and I've talked to the family. It's been challenging, but they are getting by. For all her 9 months, she was seeing our gynecologist.
I think about stories like that where, I mean, triplets, that's a hard birth regardless of where your, environment is. But I can imagine had CMB not been there, that the chances of survival may have not been what they were because of her treatment at CMB.
Yes, because at the last minute, one of the babies was in transverse and she needed to have an emergency C-section. And we're thankful that we're the only 24/7 surgery ward open.
The other side of public health is also, I believe that CMB has what you call a poor fund.
Yes.
Can you tell us a little bit about that?
The Poor Fund, it's a charity fund for those who can afford to pay for their health services. And when you come to CMB, regardless of your ability to pay, we provide all the necessary care. And if your time has come and you need to go home and you can afford, and it's decided on a case-to-case basis, because as much as we'd love to help, what is donated to the fund doesn't cover all of the expenses. And then secondly, we don't want we truly desire that it is those that are truly in need that have access to this fund. So it's really on a case-to-case basis. How long have they been here? How much can they provide for themselves? We take care of you regardless of your ability to pay. We never turn away patients.
Yeah, I think it's important that we speak a bit to the context of healthcare in Haiti as well. So there's not health insurance or government support for healthcare, as there would be Medicare, Medicaid, and different social programs like that within the United States. Plus, a lot of people have health insurance through their employers and whatnot. But my experience, at least in Port-au-Prince, is that you can go to the hospital, but that doesn't mean that they'll give you food or water or sheets or different things like that. Can you give some context to what a typical hospital that might not be like CMB is like?
At CMB, we don't provide food, but we provide sheets, hospital bed sheets, and there is a designated space. There is a kitchen where relatives and family can cook their own food for the patients.
Also, in Port-au-Prince, I know like blood transfer is really difficult.
Yeah.
is there a blood bank in northern Haiti, or how is that handled? That would be interesting.
All of our blood transfers come from Red Cross. Yes, yes, they all come from Red Cross, and that is one thing CMB is looking into, to have our own blood bank, because an emergencies where, especially for surgeries and stuff like that, it's because we have to send for sometimes, and if you don't get it at the local Red Cross, you have to travel to the next town, which is Gonaïve, or even closer to Port-au-Prince, Saint-Marc, to, yes, to get a liter of blood.
Yeah, so if an emergency, say, happened at 8 o'clock at night, the chances of getting blood to CMB are next to impossible then?
Um, Almost, yes, unless we're able to get it from the local Red Cross downtown.
Okay, and that's in Port-au-Prince?
Yes.
And then my understanding is that you can't take blood out of the bank until blood's put in the bank. So if I was having surgery at 8 o'clock at night and something happened and I needed blood, you could go to the blood bank, but the blood bank isn't going to release the blood I need until friends and family members donate their blood.
Yes. You would need at least 4 members. They usually say 4 members would need to go down there to donate themselves before you could be given blood.
The issue with that then, right, is that if it happens at a time where the Red Cross is not there, like a Sunday or late at night, then that could mean,
Or if they are on strike.
or if they're on strike, yeah, then that could mean very bad circumstances for the patient.
Yes.
So CMB, that would be a goal in the future, is to have a blood bank on site.
Mm-hmm.
Then do you have any examples or any patients that stick out to you of a story you could tell us about their life coming to CMB and how it was changed through the care that they received through the hospital?
Recently, there was a family that was poisoned. It was by a gas, due to a gas leak in a home of a family in town right here. And if it weren't for CMB having been brought here as soon as they discovered that they were unconscious, they would have passed away, unfortunately. And I remember how the woman was speaking, the mom, she's like, every day, it's not something that she thinks about. She takes CMB, she takes the hospital for granted, knowing that it'll always be here. And but it wasn't until that day that she realized really how important to have a hospital at walking distance from you, and that proves not only to have a hospital, but that works, that provides actual services and all that. Because it could have ended differently for them if they had gone, if they had taken more time, and if they had gone elsewhere.
That's a powerful story. I remember one of the blogs you wrote recently as well talked about a girl, and I believe maybe she had burns, and originally she had gone to a witch doctor. Was that correct?
It wasn't burns. It was she was from the island, from La Tortue.
Gangrene? Was it gangrene? She had an infection.
She had gangrene, and her family thought it was a spell had been cast on her, and that she needed to be taken to the witch doctor. And when she came here, even when she came here, they still thought that she needed to be taken to the witch doctor. And finally, when they brought her here, come to find out she had gangrene and she needed an amputation. Had she not come here, she probably would have lost more than a limb.
That touches on an important topic, as well as that there seems to be an educational or cultural piece that comes along with healthcare, especially in a lot of these rural communities. What has been your experience in that? Do you have people been very receptive to modern forms of healthcare? And when they're not, what have you found works well so that people can get the care that they need?
And this is where public health comes into play because preventive care oversees education and immunization, and education really plays a big role in our in our work, because without education, there's this conflict um, between cultural beliefs and actual science. So education really plays an important factor. For example, in family planning, and even in most recently with COVID-19, there were so many superstitions, so many lies and myths going on, and all people were concocting all those drinks that they heard about, that they read about on WhatsApp, that they read about on Facebook, or that they heard from somebody else, that heard it from somebody else, and all that. And when you have them sit down and really talk to them and tell them these are the facts and this is how it affects you and this is what you can do to prevent from getting it, it really goes a long way.
Thanks for sharing, Berzina. Can you tell us a little bit about CMB and your maternal health program?
Haiti right now has the highest maternal mortality rate, though it is declining. And our new maternity center came to be 2 years ago. We're helping reducing that rate. We provide ultrasound, cervical cancer screenings, and family planning services. And we have been seeing an increase in delivery numbers, and already our 40-bed center is over 100% capacity. So we're looking into ways that we can expand our center already, and it hasn't been 5 years yet.
Can you tell us a little bit more about the future projects of CMB?
There is an increase in demand of all our services. That's why we've decided to launch the construction project for the adult clinic, and that will be something people can read about on our website really soon.
Can you tell us more about the adult clinic, the expansion?
More and more people are coming to the hospital every day for an outpatient, and to accommodate our patient needs and to provide better access. That's one of the things, to accommodate the growth of CMB and to provide better access. We're gonna expand the clinic. We've already broken ground last week, and we are looking to raise about $300,000 US dollars to complete the new adult clinic, which will be used as not only clinics but offices, office space. We need more office space. We need more clinic, and to accommodate because as the services grow, we need more human resources. So we'll need more doctors and nurses and things like that.
Do you receive medical teams from the States, or is all the staff locally trained?
That's one interesting fact about CMB is we are 100%, since the 1990s, we are 100% run, Haitian run, as in day-to-day management and operations. But we still do get visiting teams, and teams can volunteer to come either in physician mentorship or just do a week of on medical missions and stuff like that.
So a lot of our listeners will be like Americans who like love Haiti, and they come to Haiti a lot and they volunteer and do different things. But like me and you talked about at the beginning of the conversation before we were recording, like that, they might not be doing like what isn't necessarily the best. So what are some things like that us as foreigners can learn or implement to be more sustainable within our healthcare?
Make sure, the number one thing I would say is make sure whatever you're coming in to do, you're training locals to continue to do it when you're gone. Because if you're not, it really wasn't sustainable development if that's what you were aiming for. And then be open to learning. Be open to learning from the locals as much as they will be learning from you.
Maybe expand a little bit about like something you've seen, or for example, like I love that you talked about learning from locals, that it's not necessarily just about bringing a US education down and trying to apply it into environments where it won't be adapted in.
To elaborate on learning from locals, know that you're working alongside with them. When you leave after your 1 week or your 1 month, they will be the ones here with the people, and so you need to respect that. And if you really want to have long-term impact, the best thing to do is to train a local to continue with that work.
So what are some ways that listeners can get involved in what CMB is doing?
First is to keep us in our prayers, prayers for protection, prayers that will continue to be a beacon of light, and really people will see Jesus through our work. And physician mentorships, people come in and train our nurses, train our physicians, especially biomed specialists. They can even teach English as a second language. We need X-ray experts, orthopedics, stuff like that. And they can also donate. They can either donate their time or their money. They can donate to our core fund, which is our charity fund for those who aren't able to pay. And they can donate to our scholarship fund. We sponsor physicians in training. And then after they are done, they come and give back to CMB, and they can donate to funding our projects. Right now, two of our main projects is the outpatient clinic and energy. I don't think I mentioned that before, but we run on generator power during the day and inverter at night, and ideally a 24-hour uninterrupted energy supply is what we would need for safer care and all that stuff. And energy is one of our biggest need right now.
The fund goes to the general maintenance of the generator, as well as gasoline and whatnot to keep it going.
Yes. And as I said, we'll soon be launching a fundraising campaign for the outpatient clinic that'll cost us $300,000.
Do you have city power where you are?
No, not since I was a baby.
See, okay, so even if there was city power, it likely wouldn't be strong enough to run an entire hospital, much less there's no city power at all. Therefore, you absolutely need a generator in this energy fund. That makes sense.
We don't even have city water.
Yeah, and no city water. So you have a cistern then? Is that how?
Yeah. Okay. Mm-hmm. It supplies both of our campuses. We have the hospital campus, and then campus where doctors and nurses stay. And another need that we have is to build more dorms and more facilities that can house our staff.
Brianna, can you share with us what your advice would be to other nonprofits that might be listening today, or those working in public health?
Besides the fact that if those two American missionary nurses that had come in hadn't trained locals, their work would have ended with them when they had gone. And to see, even just right now before this interview, as I was looking through our history, and I'm really grateful that they took the time to learn and teach the others, the locals and stuff like that. And this work has continued on years and years after their death, and after them being gone from this earth. And it's a really beautiful thing to see. And they're, how to say that, and a whole hospital years and years later with what started out as two women treating, wounds from that their neighbors or people that were passing by had. And it has now turned into a multiple pavilion facility seeing hundreds of thousands of people every year and impacting millions of lives. And I'm grateful for Dr. Oli's Fold and his legacy, because he was the first physician that CMB had, and he was Haitian, and he trained others, and his work continues on. What else I have to say? Oh, yes, please visit our website, subscribe to our newsletter and our blog, and soon we'll have a Facebook page, CMB Haiti, so follow us there. And thank you, Callie, for having me. Thank you for taking this time, and thank you for bearing with me. And yeah.
Thank you, Veridina. It's been so wonderful to talk to you today. I am blown away by the work that CMB has done. I've been able to witness it from afar now for a while, so it's been great to talk directly to you and hear some of what's happening and see the continuous growth that's taking place in the community.
Thank you.
Thanks so much for listening today. If you'd like to get involved in the work that CMB is doing, you can find them at cmbhaiti.org. As always, all relevant links will be found in the show notes at lapointefoundation.org, or you can find us on Instagram. Until next time, keep on fighting for justice.